Lyon. I'm here with my daughter Juliet. Deer on the float wave. And we're going to share a little bit about Juliet tonight and her story. Like you mentioned earlier, she has a rare disease, and it's called FAVA, or Fibro Adipose Vascular Anomaly. Earlier today I was practicing my presentation, and the advice from my husband was to try to sound not too much like a typewriter. Of course, Juliet piped in later to say that she wasn't going to say anything, but I should try to sound more human while I present. So bear with me while I get through this. So to give you some background, I know the doctor earlier had mentioned some different healthcare professionals and occupational therapy being one of them. I've been an OT for over 20 years now. Not really sure how that all happened. Time goes by very fast, but in that time I've seen a lot of different patients, a lot of different diagnoses come through. So I have my own clinical background to fall on. With that, I just kind of want you to imagine for a moment a small child who's in constant pain. Who no matter what you do, no matter what specialist you see, there's really no end in sight to the pain. So I'm going to share with you Juliet's story. During this presentation, I'm going to wear many hats. I'm going to be a clinician, I'm going to be an educator. I'm now the head of a foundation because there's really not a lot out there without FAVA. So I started a foundation, but more importantly, a loving and caring mom to my Jules, and my son is out there somewhere too. This is a picture of Juliet when she was just about a year old. Now, of course, she's grown into a bright, beautiful young lady. When Juliet was born, she had a small area on her right inner thigh. It was a tiny little red spot that was really no bigger than the head of a pencil, kind of like the size of the eraser at birth. And kind of what we found was that over time it morphed and changed as she grew and became something much more invasive within her leg. The following slides are just going to show you some different changes that we saw as she grew. So I don't know how well you can see that, but from that tiny little pencil point of an eraser to massive bruising changes, masses within her legs. You can kind of see in the picture there's some areas that started at that point in time in her calf. A couple more pictures. She's probably about between 3 and 4 years old during this time. And pretty well every day, and even to this point, like there's another shot of it. It just was constantly changing. It looks like a blueberry. And so it definitely changes. And even now, today, every day she wakes up and it looks a little bit different. Another photo of the bruising. So it's constantly changing, very bruised, very painful for her. And we were told from the doctors that these were episodes of thrombophlebitis. But we took her from one doctor to the next. We were seeking some type of a diagnosis that would put us in line with some type of a treatment because she was in so much pain all the time. As a toddler, she fell every day, constantly. I think sometimes we were counting up to 30 times a day. She would be up, down, up, down. We started applauding her for standing up because we needed to find something positive about it. So some clapping for Jules. Bravo, Jules. Doesn't fall nearly as much anymore, so that's a good thing. So looking back, I think there were definitely moments where Juliet may not have been able to convey with us how much pain she was in, and maybe did some acting out as a toddler. I know my mom remembers a time on vacation where we had a bit of a meltdown. But looking back, I think she was just really in pain and really had no way to convey that to us. Juliet and I and her dad, we've been to many, many different doctors. Varying diagnoses were offered to us, but really nothing definitive. So we heard about venous malformations, lymphatic malformations. Did she have a hemangioma? Was it a vascular anomaly? And with each different diagnosis came like a different set of treatment options. So when we thought it was a lymphatic malformation, we were doing compression garments. Poor Jules actually even punched herself in the face trying to get one on her leg once. And took a corneal abrasion. It's been an adventure. So with that, we've even tried things like over-the-counter pain relief, anything to kind of combat the daily pain that she's been in. Back in, I think it was 2011, 2012, we actually made it to another pediatric orthopedist, and he actually suggested, we hadn't heard of it yet, but that Boston Children's Hospital had a vascular anomaly center, and that they might be able to point us in a better direction. So off we went to Boston Children's. Kind of the neat thing about Boston is that the center itself is comprised of 25 different physicians, and they represent 17 different specialties. So when we went, we had a great team of doctors looking at her and looking at her MRI scans, looking at the ultrasound that they did with her while we were there, so we can get some better information from that. This is actually Juliet's MRI studies, and you can see kind of the darker, the part of her lower leg, so see the white that's kind of in the middle of the muscle belly. That actually should be muscle, but that's what the actual fibroadipose vascular anomaly is. There's also a spot on her upper thigh that you can see that's kind of off to the side, and that's kind of the masses that you were seeing on some of the earlier pictures. So up at Boston, they review her medical history, they do an ultrasound, they're looking at the MRI studies, and we were given a definitive diagnosis. So now we've got this diagnosis, and we're told it's a fibroadipose vascular anomaly. We're told that there's really not a lot of literature out there to support it, but nonetheless, we get home from Boston, we start scouring the internet, we're looking for more information, and we got a whole lot of FAVA beans, which of course was frustrating because there was really nothing out there. And it really wasn't until last January of 2014, that there was actually a paper that was published. One of Juliet's interventional radiologists, Dr. Anomalies at the Boston Children, is one of the physicians who published this first paper. He was the first one on the paper, but he actually did a retrospective study of lots of kids that they had seen in the Vascular Anomalies clinic, and actually finally put a name to it. So thus we have FAVA. So the components that warrant a diagnosis, so we've got muscle fibers, like I said earlier, replaced by intramuscular lesions. Primarily, most kids with FAVA, at least the ones that I've now come into contact with, is lower extremities that are affected. There are a couple that I know of that have some issues in their upper extremities as well. But we've got fibrofatty overgrowth, enlarged dilated veins, lymphatic malformations, atrophied skeletal muscle, and joint contractures as well. So along with that, those are the most commonly seen symptoms. So on our trip to Boston, we really had to have a better review of the available treatment options for Juliet, because the most concerning and potentially life-threatening thing that they noted was that Juliet had 2 enlarged dilated veins that put her at risk for pulmonary embolism. So that was kind of a big deal. So we immediately scheduled her for surgery, and she had embolization done, and they placed coils in those 2 veins that they found so that they could prevent the blood flow and the potential for a pulmonary embolism. So here's Jules. So her first procedure she had at Boston Children's was in August of 2013. So the paper hadn't even been published yet. But we did sclerotherapy. I say we. I didn't perform the operation, but I feel like I was very much a part of it. So they did sclerotherapy, which wasn't really too effective with her because she has microcytic disease instead of macrocytic. They did CO2 laser treatments, so you can kind of see all the areas on her leg, and there's even more on her calf that were done, as well as the embolization. So that was all done in one surgery. Juliet is tremendously strong, brave, did her own wound debridement, scrubbing out the wounds in the shower. She's like a superhero. She's amazing.
She is. Yes.
Amazing.
Hey,
Here, everyone. They're like, oh my God, yeah.
Absolutely.
She's amazing. So these pictures, so we actually ended up going back to Boston Children's. Not a heck of a lot of results. I mean, thankfully we did the coil embolization, which is amazing, so we don't have to worry about a risk for PE so much anymore. But really didn't get a lot of pain relief, was not really changing so much in terms of her pain. So we were actually brought in to see another interventional radiologist up at Boston who recommended that she try cryoablation. And we've been done on a few kids with FAVA before, so they thought, okay, let's give it a go on Juliet. We'll see how she responds. So initially, one portion of her thigh was treated, as well as the instep of her foot, which is primarily the 2 areas that give you the most pain. Yeah, Jules, yeah, okay, we're nodding. So they focused on those 2 areas first. So again, limited relief from that, so we go back again in June. So they take a little bit more of an aggressive stance, more aggressive approach, utilize the ice ball and the probe a little bit longer on both her foot and another section of her upper thigh. So again, still not really having a lot of relief from that. So she, at that point, went to a pain clinic, had an appointment with them, which consisted of a physician who specializes in pain, a psychologist, a physical therapist, and I believe a nurse were on that team at Connecticut Children's, actually. We were actually just there today. And so we're looking at different ways to handle her pain. These pictures were just taken last week, so you can see from the photos, I'm sorry, they're a little hazy, but the lesions are still there. She definitely has some scarring in place because of all of the CO2 laser treatments that she had, but it continues to change. As she gets bigger, so do the masses that kind of are moving. It's like hitting a moving target. And her pain is unfortunately still ongoing. Here's Here's another picture taken last week. She does have a small joint contracture in her right knee, so we pushed along with that. Like I said earlier, I'm an occupational therapist, so I try to work with Juliet. We try anything under the sun to try to maintain that contracture, try to help minimize her pain, because that's what therapists do, but that's also what as a mom, I need to do for her. So several years back, I actually developed the rules of mom, is kind of what I call them, for my kids. They've got them framed in their room so they don't forget what they are. In addition to my daughter, my son, Daniel, he's in the way back. Hey, Jay. He's 13. He's Juliet's older brother. He's really happy that I just pointed him out right now. Sorry, Dan. But these are the rules so that they kind of know always where I'm at. So you have one mom, and I love you unconditionally. And she's supposed to save me if I start crying through this. You are irreplaceable to me. You come first above all others, and I will always be your person. I did it. So being that I'm Juliet's person, and she continues in pain in spite of the treatments that she's had, I decided I needed to do something, because there's so little out there about FAVA, and there really were no resources for us at all. So we started a foundation. Crazy. So actually, right before, I think, your second procedure, Juliet and I sat down and we were kind of scouring the internet, and we landed on the Susan G. Komen Foundation website, and she has the story about it just takes one person. So I'm like, okay, well, I think that's going to be us. So we dove in, and we started the FAVA Foundation. Juliet's dad actually designed our logo. It's quite artistic. He's in the back with Daniel. But we had to do something, because it's scary as a parent, and to not have any resources, to not have anything that you can read or look at. It's difficult, because you're not making informed decisions, and you need to be, because every decision that you make for your 11, 12, 13-year-old child is going to affect them for the rest of their lives. So we kind of felt that it was super important that we get something out there so that we can kind of tap into, some resources together and branch out with other families and other kids that are in the same boat as Juliet. So help from my mom and sister, also here in the audience supporting us. We started the foundation. So ultimately, our goal is to support research, because we need something to be done. It's a rare disease, so it's difficult because there's not a lot of people out there with FAVA. We're finding more and more each week. More and more people are coming to me, which is fantastic. Sad, but fantastic at the same time that we can kind of come together and do something. But we developed a website, so we have resources now for other people who have FAVA. We have an opportunity for people to connect with one another. We have a closed support group that began in October of last year that has mostly parents. There's actually a couple of adults that have now since been diagnosed with FAVA. So they actually lend a very interesting perspective, because they can share their experiences, and many of them have had multiple surgeries and procedures during their lifetime. But it's been enlightening. I think, as a mom, it's been tremendous for me, because I now have other moms that I can talk to that have children that are in the same boat as Juliet, that are hurting, and we can kind of band together and support each other. So speaking of moms, this is my mom, with Juliet, and it's Mim Wisdom, because we call her Mim. Years ago, my dad decided that everyone had a mom, we're going to have a Mim, so and so that's the Mim, and Mim has always talked about the whiz kids, and that someday there's going to be some whiz kid out there, someone's going to go to medical school, or it's going to be a geneticist or something, and they're going to find the answer. So as moms are always right, so is my mom. The Mim is always right, and there was a paper that actually just came out last week. It was in the Journal of Pediatrics, and this is kind of what gives us some hope, and it was titled, "Lymphatic and Other Vascular Malformative Overgrowth Disorders are Caused by Somatic Mutations in PIK3CA." And it had contributions from a young Harvard whiz kid named Nolan Kamataki, and basically what they found was that mutations in PIK3CA are associated with overgrowth syndromes, as well as some cancers. And so what we're hearing now is that there are actually researchers that are working to establish better cancer therapeutics that might also have treatment implications for people who have FAVA as well. So I hope that you guys leave here enlightened. I'm going to do my part to spread the word about rare diseases. I hope you guys all do the same. But I think more importantly, I'm going to let Juliet talk to you a little bit about what it's like to live with FAVA, because, as you guys have all mentioned earlier, it's about the patient. It's her story. It's about what she goes through every day.